Thank you for joining us. I'm Dr. Debbie Wallace, and this is my husband, Dr. Tracy Wallace. Welcome to True Health Doctors.
Today we're talking about cervical cancer. Every year in the United States, some 12,000 women are diagnosed with this disease. Another 4,000 women die from this disease every year. But the good news is that cervical cancer can be diagnosed early and potentially prevented. There are risk factors for this disease.
Yes, and one of the risk factors is smoking. Smoking puts you at risk for cervical cancer. Another one is having early onset of sexual intercourse. Delaying sex until you're married is always a great idea. Abstinence we want to promote because, again, not just having sex early, but also having multiple partners put you at risk for cervical cancer.
You know, HPV, human papillomavirus, that is the most common cause of cervical cancer. But the good news about that is there is a vaccine that can actually prevent this infection, and currently it's available and is now recommended for boys and girls to have this at 11 and 12 years of age. The pap smear is critical here because having an annual pap smear detects HPV infection, and once it's detected, it can be treated. And that's really the key here, to be screened regularly in order to detect this virus and to be able to be treated at an early stage so it does not progress into an invasive type of cancer. And that's what the pap smear is all about.
So we want to recommend that you do have your annual pap smears. Now, I know there's been some confusion lately about this and maybe delaying having it every other year, but we recommend that you have your pap smear every year because it's always good to have early detection. That is the key.
You know, they do say, I have to say that official recommendations say that if you've had several pap smears that have been normal and there has not been any change in the partner or any other risks associated with it, then sometimes they do recommend going to every other year. But we're going to see in just a few minutes that even skipping a year or skipping a couple years can be very devastating for some people.
Yes. And the bottom line is that you need to talk to your primary care provider, because when you talk and be open with them about your sexual partners and all that's going on, they're able to give you the best recommendation. And that's what it's all about. You've got to make sure, remember, it's a partnership. You and your primary care provider, because they want to see you healthy. They don't want to have you come down with disease. So when you tell them what's going on, be honest with them about what's going on, they will be able to make the best recommendation for you.
It's an excellent point because it's so easy to not want to mention, well, I'm smoking now, or the fact that I've had multiple partners or those kinds of things. But these are risk factors, and we're dealing with somebody's life here. Could make the difference sometimes between life and death.
Yes.
Welcome back to True Health Doctors. We're talking about cervical cancer today, and we have a special guest, Miss Linda Francis, who's with us today. Thank you for joining us today. It's good to have you here. So tell us a little bit about how this diagnosis came about.
About 3.5 years ago, I started having some symptoms of lower pains, and then I was bleeding excessively. And I had missed 2 previous, what do you call them?
Pap smears.
Pap smears, sorry. And which I knew better because my family is riddled with cancer.
I see.
So I had a pap smear, and it showed precancerous cells. So I went to Louisiana to stay with my mother because I had a feeling, I was going to have to go through cancer treatments. And went to LSU because they have a teaching school and they're a very good cancer program there. Went to the doctor there, and they did a biopsy and found out it was indeed cervical cancer, and it was stage 2. And they were afraid that it was actually moving to the bladder. So they wanted to, put me in treatment right away.
See, I wanted just to back up just a little bit because you said that you did miss a couple of years with the Pap smear.
Yes.
So you had been going pretty much on a yearly basis, and so basically 2 years had gone by, and you had not had a Pap smear. Now, what's interesting for me as a physician is that a lot of times now they're saying do a Pap smear every other year.
Yeah.
Okay, so you weren't that far behind when it really look at the whole scheme of things. You just missed a little bit, but 2-year period without a Pap smear was all that it took for you to end up into this stage of cancer.
Exactly.
Okay. Now, when you started to have the symptoms, you had the Pap smear. How much time before you actually had the biopsy? Did things happen fairly quickly after that, or was there a little bit of a delay?
About 6 months.
Okay.
And then once they diagnosed it, it was about 6 weeks before I went into treatment.
Okay.
Yeah.
All right. So then tell us, what kind of treatment did they do then?
They did extensive radiation. I had to have, for 3 months, 5 days a week, radiation. And then they did chemo once a week, which was, and it was a strong chemo. Fortunately, I didn't lose my hair.
Okay.
But they would put me in the hospital in the morning, and all day long they would, administer the chemo. And it was really scary because the nurse would come in full biohazard gear, carrying this bag that she was fixing to put this chemical in my arm, and I was like, but why are you covered in this?
Yeah.
But, she dealt with it all day long, and so,
Yes.
they had to protect her. But it was pretty scary.
It had to be, because you see somebody coming in a suit. It's
scary.
like, if it's bad for you,
Yeah. Why are you?
why is this good for
You're
me?
putting this in my arm.
Yeah, it had to be kind of
Yeah.
scary.
It was. Yeah.
But how was the whole experience after you had the chemo? How did you do with it? Was it
Not well. I mean, I would say that was probably the hardest part of the disease. I have to tell you, the cancer community is made up of some of the most wonderful people on the planet. They're so supportive
Yes.
and kind. But the chemo makes you deathly ill. I mean, just, you don't want to get out of bed. You don't want to, you just basically stay in bed and sleep is the best thing to do because you're too ill to do anything else.
And how long did that go on for?
For 3 months, and so I did it for 12 weeks. Yeah,
Now,
so every Friday for 12
Was
weeks.
there surgery involved in this as
No
well?
surgery.
No
They
surgery.
didn't do surgery. No.
Okay.
And it's completely gone.
All right.
And it's been, like I said, 3.5 years, and still no return of cancer. But my oncologist said you will always be a cancer patient.
I'm
Always.
glad that they told you that, because
Yeah.
sometimes people think that's it will never recur. And you have to stay vigilant, and you have to look and make sure that does not recur. But you did really well with, so far since the 3 years, and it's good.
I wanted to, because you talked about there was a family history, a strong family history of cancer.
Yeah.
Was there actually a family history of cervical cancer or other types of cancer?
No
Okay.
cervical cancer. My mother is a colon cancer survivor. I have other family members, a couple of other family members that are colon cancer survivors.
Yes.
I have an aunt that passed away of breast cancer, and my father died of liver cancer.
Okay.
But
All right.
no cervical.
So I'm kind of curious. I mean, there was no cervical cancer, but you said almost like you knew that you needed to keep up with this thing. So in the back of your mind somewhere was the fact that, okay, there's a lot of cancer in my family, so I need to at least keep up with my cancer screenings, which would be like mammograms too,
Absolutely.
and Pap smears, and even
All of
having a colonoscopy and all these kinds of cancer screenings. And so you had made a point of keeping up with this, but then this sort of missed. It just
I
missed
thought,
that.
well, I can, slide.
And I'm not sure if you, in retrospect, beat yourself up by this, but it's if you're doing this every other year, it's easy just to kind of miss a year. In fact, I had a patient come in, and he said he was here for a 6-month follow-up, and I was looking at him, and I was like, I cannot even put a face. I cannot even remember who you are. And he says, I'm just here after a 6-month follow-up. Well, I looked, and it was a year and 6 months. But to him, it'd only been 6 months since he'd last been here, and it was like it had been a year or 6 months. So, I'm just saying that time flies by. It's so
That's exactly what
easy.
happened.
It is so easy without putting this on the calendar to miss a screening. Just so easy to miss a screening.
Yeah. And when I was diagnosed, truly, for me, it wasn't an if, but a when. because there was so much cancer in my family.
And that's what I kind of picked up when you said that. It was like you
Yeah.
knew something at some point would be happening, so you knew you needed to kind of keep up with the screenings.
And then I just sort of kept my head up. I didn't let it, I wasn't depressed or upset about it. I just, pulled up my bootstraps and said, let's get through this.
Okay.
Tried to keep a positive attitude.
And
which
that's
is
good.
one of the doctors, the
Yes.
doctors said repeatedly that was, one of the
Yes.
best things you can do to get through it is just keep a positive attitude.
Yeah, that's
Absolutely.
good. That's good. And so, going through an experience like this, what would you say to somebody at home who may be watching who has been diagnosed with cervical cancer?
Well, first of all, they've made milestones with that particular cancer. I mean, it's not a death sentence. The treatment works, 99% of the time. So, I would just get the treatment done and get through it. It's not going to be a lot of people think it's a death sentence and, are really worried about it. But this particular cervical cancer, does well with treatment. Plus, if it's the papillomavirus, there's shots for it, so it's preventative.
Yes.
Yeah.
All right.
Very
Yeah.
good.
Well,
Very
we've been talking with Linda Francis about cervical cancer. We're going to take a break right now, and we'll be back right after these messages.
Welcome back. We're here talking with our guest, Linda Francis, about her experience with cervical cancer. And Linda, you mentioned that you had just taken a little break from not planned. You forgot to get those pap smears in for just 2 years, and then you were diagnosed with stage 2. So I know that a lot of people out there are thinking that it's okay if they miss a few, but what would you say to them?
Don't do it.
Okay.
Even if you don't have a family history like I do, especially if you have a family history like I do, don't do it. But it can sneak up on you that quick. I didn't expect it, to be as advanced as it was, and I certainly am diligent about it now. I make sure I get my mammograms and pap smears and colonoscopies and everything I'm supposed to, because it's scary. I mean, you miss it for a couple of years, you think you're okay, and next thing you know, you're in treatment.
Right. And you didn't have any real pain or anything, right? You just noticed what was unusual while you...
Not right away, but about 6 months before I was diagnosed, I started having, some symptoms.
Okay.
And I knew I had to do something about it.
Okay. But you said that the community was very supportive. What do you mean? Who was supportive?
Every single person in the cancer community, from the nurses that take your blood to the techs that do the MRIs, even the support groups that are out there, they offer you, if you need a ride to your radiation, if you need wigs or scarves, or, it's just amazing. And the doctors are so compassionate, and you really feel like they're in the fight with you, that you're not alone, that, they're with you every minute, and and certainly they are, because if you have any questions or worries, or they almost anticipate them, before you can come up with the worries. They soothe you before you even can figure out I'm worried about this. They've already covered it for you. So
That's wonderful.
yeah, it is.
Well, cancer, the diagnosis of cancer is a very scary thing. I think what was different in your situation, because of the family history, you knew that maybe at some point you would have to deal with it. But a lot of people get sort of hit and just out of nowhere, just get smacked with this diagnosis. But what we're seeing over and over again is that there is life after cancer. And you can go on and live a long, productive, healthy life after cancer.
Absolutely.
And what I love, too, is the fact that there is a community out there that deals with this, that is supportive, that even knows what you need before you may even know that you need it, because they deal with these things all the time. And this is what we want to be able to share with people, is that the fact that there is life after cancer, and people like you out there walking around would never know what you've been through until you start to talk. But you are an inspiration to somebody out there who will be watching and seeing this.
Hopefully.
Thank you so much for
Thank
joining
you.
us.
Welcome.
We'll be
appreciate
right
it.
back after these messages. Thank you for joining us today on True Health Doctors. We've been talking today about cervical cancer and the importance of getting regular pap smears. We hope we've been able to inform, inspire, and empower you today. And we hope to see you soon on another episode of
True Health Doctors.